Hello, everyone. Hello, Amaresh. I see you. You could please rename yourself because I see that because you used my link, I think you have your name, my name. Yeah, thank you.
Hi, Ahmed. Do you hear me? Elham here.
Hello, Elham.
How are you? Sound quality
Doing
good?
well. Yes. May I ask if you're using a headset?
Yes, I am. How is the quality
Okay,
right
perfect.
now?
Yes, it sounds good. Thank you.
Right. I will turn on the camera. Just give me 2 minutes.
Okay, perfect. Just so you're clear, this is not the Ahmed. This is Robert from Global
Oh,
Lingo. We provide interpretation.
sorry.
Yes. I just
Thank
thought I'd
you.
clear up the confusion. Yes.
No worries.
Hello, Susan. I see you as well. Could you please rename yourself? Because I think you used the link that I gave you and it kept the same name.
Yep, no worries.
Thank you very much.
Good morning and good afternoon, everyone.
Hello.
Hello. Hello, Alham. Hi, Robert, all interpreters.
Hello.
Hello. Please give us a few minutes. Ahmed is having some challenges to sign in. So just please give us a couple of minutes. Thank you.
Of course, no worries. In the meantime, if possible, do you think I could perform the sound check
Yes,
for
please,
the yes, check the interpreters and make the settings? Could you please give me co-hosting rights for this?
Absolutely, absolutely.
Thank you very much.
Sure. Okay. Anderson. Sorry, I didn't create this meeting, so.
Oh yes.
Just
yeah.
Okay, Anderson.
Yes, Anna. Yep.
I am not able to make Robert a co-host. Did you create it as a webinar or as a meeting?
I think this was created by Ahmed, right? I created it first, and then from here, I created a webinar in the beginning.
Okay,
and then
I
Ahmed
see.
something.
So I'm really sorry, Robert, because it's been created as a meeting.
Okay.
So we don't have this permission. How can we fix it?
Well, I see that Anderson is the host. If you could, do you know how to promote someone to a co-host, Anderson?
I should go to the
you click
settings.
you click on those buttons on the right. You see the 3 dots. If you can click, Anderson,
Mm-hmm.
on them,
Yes.
right? Do you see the option to promote as a co-host?
For
For Robert.
Yes, and
only
for the interpreters as well.
Okay, make co-host, right?
Yes.
Thank you very much. And if you could please do the same for the interpreters, that'd be great. IS interpreter Amaresh
and for Susan.
Okay,
Susan,
sure.
yes.
Make co-host for Amaresh and Susan. Gotcha.
Thank you very much, Anderson.
Thank you.
Great.
Thank you for the
Very
guidance.
helpful.
Thank you. Wonderful. Let's double check. Do we have captions? I don't see captions option.
I see that the captioner is as an attendee, so they should be promoted to panelist.
Yes, but the challenge is I don't see the captions as an option, so I'm not sure if Ahmed set it up or not. Okay, let's try. Anderson, would you be so kind to promote a captioner? Who is our captioner? Kengapal is here.
Who will be the captioner today?
I see we have Kelly Linkowski.
Hello, colleagues.
Hi, Gopal.
Hi, how are you?
We are good. Ahmed is having some technical challenges to log in. He set up the meeting, but we are okay with sign languages. Sorry, my son is on the camera. And we are trying to figure out the captions.
Okay,
Okay.
that's why I was pleasantly
Okay, Ahmed is
surprised
here
to
too.
know.
Great.
Mm.
Ahmed, welcome. Welcome.
Sorry, I have
Ilham,
to enter from my personal email. I don't know why UNICEF is not working.
That's strange. That's okay, Ahmed. I think the main challenge we have right now in this
Yeah.
setting, it was not captions.
There are no caption.
Yes, I think that's the current challenge because when we set up when we're setting up the webinar, there is an option to allow captions. I'm not sure if
Okay.
it's done.
Can I?
Okay.
There is an
Yeah.
option here that says your caption settings show captions. Can I just put that?
Yes,
Yeah.
Anderson, please, as a
Yes.
host, please allow it. And we're gonna test it right now.
Okay, so now it's
Hi,
already
Kavita,
on.
good to see you. It's on.
Mm-hmm.
Okay, we don't have it on our screen yet.
Maybe when you go live, it will work.
Anderson, because we are
On
not
practice,
we're
right?
panelists. Is Kelly with us so we can test?
Ahmed, don't worry,
No.
everything will be fine.
Oh,
absolutely.
yes.
Don't worry. Don't worry.
Kelly, I didn't see Kelly until now.
Anderson,
Yeah.
sorry, could you
No, no.
please, yes, can you please check the captions if we can activate?
Caption settings. Let's see.
There should be a button saying captions, and then if you click on it, it will say assign the captioner. I'm gonna call you on WhatsApp video and we'll solve it.
Yeah.
Okay.
Sure.
Andrew, Kelly is here, but in attendee, so she cannot. I think that she cannot enter now as panelist. So if you even, but I cannot assign her as a because I'm not now
I promoted you as a panelist.
Okay.
She will join now.
Okay, great. Thank you, thank you. I'm so sorry for the interruption at the morning. I'm not sure why my account is not working.
Don't worry.
This is Kelly, the captioner.
Hi, Kelly.
Hi, I will need to be assigned to closed caption. Or I
Good
can,
morning, Kelly. Give us 1 minute, please.
Okay,
I'll
thank
assign you in a
you.
second. Thank you. Thank you. Kelly, we just assign you.
Yeah, Kelly shared the link.
I shared the link. It doesn't look like I've been assigned yet.
Just a second, please.
Ilham is there.
Yes, Elham is here. How are you?
Good. Why am I not hearing your voice?
Because I'm just muted, figuring the last minute things out. As you know, we always have something else to do.
Okay.
How are you doing?
Good, Ilham. Good. Great. Happy to be on the same session after a long time.
Yeah, very exciting.
So it's already 9. Anna,
Yeah, sorry.
it's already 9 o'clock.
Yes, I don't think they have allowed the other attendees in. I don't know.
Can you hear me?
Huh?
It's Kavita. Hello.
Hi, how are you? Let
Good.
me
Hi,
do-
Gopal.
Kavita, my God, how are you?
I'm good.
I thought
I'm good.
great to hear your voice. We have not been in touch for a long time, and just the other day I was thinking of you.
That's good. I'm glad I didn't disappear in your minds, and it's lovely to see you both.
Same
I'm
here,
back.
same.
I literally joined back at WFP an hour ago.
Oh,
So
amazing. So happy. I was about to ask you. We should
it's
catch
lovely
up
to hear.
sometime.
Huh?
Soon. We should catch up sometime soon over WhatsApp.
Yeah,
I
definitely.
have, sorry. So hi, everyone. I'm sorry. I have a technical problems. That's why I'm joining from my personal email. So I have very less control. I see the captioning from my side now, Anna and Anderson. All set. Yes. Great. Yes, I can see it. It's working now. Thank you all. I'm not sure. I don't think that we started yet officially. Yes.
Mm.
Can you start from your email, Anderson, or your?
Oh, okay, just a moment, please, Ahmed. So Kelly, Anderson have shared with you via chat the APA token. Please use this. And he also assigned you as a captioner.
It's all set. Thank you.
All set. Wonderful, wonderful. Anderson, would you please click button to start and record? I think we're ready.
Kavita, can you confirm that you can see me well?
Yes, and you look beautiful.
Oh, as always.
As
You
always.
you forgot to act.
Sorry. Be telling me off for life, Elham.
Oh.
I just wanted to let you know that I'm very tanned.
Oh, beautiful.
Yeah.
It started. All good. Thank you.
I think we can allow the participants in, even if we can't start right now, at least they know that the event is still happening, because sometimes when people are in the waiting room and you don't let them in, they feel like, okay, maybe this is not happening.
Yeah, the webinar is started.
Great, thank
We don't
you.
see captions. We just want to make sure that that our captioner is typing. Thank you. We see it. Thank you.
Hi, everyone. I hope you can hear me. Hello, everyone. We are so excited to have you here with us at this webinar, Disability Inclusion and Humanitarian Response, Insight into Latest Development in UNICEF Policy and Tools. I hope everything is good. I can see that the chat is on between the team. We will start now. My name is Ahmed Ghanem, program specialist at UNICEF, focusing on disability inclusion and humanitarian action. So I will start with some housekeeping item right away. Today events have closed captioning in English. To turn on closed captioning, press the CCC icon at the bottom of your toolbar. Also, we have international sign language interpreter, so you can see it the spotlight in the video. This event is being also recorded, so recording will be available in the coming days. We encourage you, of course, to use a question and answer to engage with us with some questions, idea. We have, of course, a lot of incredible speakers today. Today we will provide some discussion around the global commitment to disability inclusion and how can be translated into agency policy strategy tool and ultimately, of course, to action. The session itself will introduce insight on latest development from UNICEF policy and tools in disability inclusion and humanitarian action, and explore other experience with World Food Program and CBM Global. I'm glad to introduce our moderator today, Ilham Yousefin, from International Disability Alliance. Up to you, Ilham. Thank you.
Thank you very much, Ahmed. Good morning, good afternoon, good evening, everybody, wherever you're based. It is my honor to take us through this fantastic event, through which we're gonna learn about a number of fantastic papers, like policy tools that has been developed by colleagues in UNICEF, and then a couple of examples on how those tools and policies are going to be and have been already transformed action on disability inclusion. This is part of the Humanitarian Network and Partnership Week 2023. Thank you so much for choosing to be here. I know that there are a number of events going on, even in the same time slot. So thank you so much for choosing this event. So as Ahmed said, we are going to have a very full agenda, so I'm not going to take a lot of time. Just very quickly, we're going to start by first learning about the disability inclusion policy and strategy, as we call it, DIPAS, have been developed by UNICEF. Then we are going to hear about the Disability Inclusive Humanitarian Action Toolkit that have been developed jointly by UNICEF and CBM Global. After that, we have a small panel to see a couple of examples of how guidance policy has been transformed action, example from UNICEF emergency team, and also example from World Food Program. Then we will have opportunities for questions and actions from you. So I encourage everybody to please put your questions either in the chat or using the Q&A function of the webinar. We try to answer as many of them as possible. And finally, we will have a recap of what was discussed and way forward on our next steps. So without further ado, I'm introducing Gopal Mitra, global lead on children with disabilities in UNICEF, who has been leading this fantastic work, who will tell us what is the disability inclusion policy and strategy and what we can expect in this document. Gopal, thank you very much, and over to you.
Gopal, you're on mute.
Okay, you can hear me. So thank you so much, Ilham, and thank you so much, friends, for being here today. And on behalf of UNICEF, a very warm welcome to all of you. And our thanks also to the organizers of the HNPW for giving us this space, albeit virtual, to come together and discuss some of the policies, tools, resources that we already have to advance disability inclusion in humanitarian action. Persons with disabilities, and in the context of UNICEF, friends, children with disabilities, we all know are disproportionately impacted by humanitarian crisis, pre-existing inequalities, a high level of stigma and prejudice, inaccessible environments, breakdown of support systems, services which are not inclusive are some of the factors that make the impact so disproportionate. I want to emphasize here that we often say or club children with disabilities, persons with disabilities are under vulnerable groups. And I want to emphasize that children with disabilities are not inherently vulnerable. These factors like stigma, like inaccessible environment, breakdown of support system, that adds to the vulnerability. And in all our action, we should therefore see how do we remove some of these barriers that exist. Reaching the most disadvantaged and marginalized children is at the core of UNICEF's mission. And this puts children with disabilities at the center of our action. UNICEF has been working on the rights of children with disabilities for many years. In 2022, for example, last year, UNICEF, through its programs, reached 4.5 million children with disabilities across 142 countries. And a significant number of these children have been reached in humanitarian context. At the same time, UNICEF's 2021 Global Data Report points out that 1 in 10 children are children with disabilities, and there are 240 million children with disabilities around the world, and most of them live in the global south. So while the figure of 4.5 million children with disabilities that we reached last year may look high, it's equally true that we are only reaching a fraction of children with disabilities that are there. Now, in February this year, 2 months back, UNICEF's executive director launched its first comprehensive disability inclusion policy and strategy, which provides a roadmap and a framework to accelerate and scale up disability inclusion across development and humanitarian context. And as I said, we are just reaching a fraction. It seems high in absolute terms, but it's a fraction. And we really need to scale up. And that is what the disability inclusion policy and strategy, which in short we call DIPAS, aims to do. Now, within the policy will bring the whole organization together to accelerate and scale up disability inclusion, and in the context of today's discussion, in humanitarian action. Let me just take the time to outline some of the commitments that UNICEF has made. Actually, under the DIPAS, UNICEF has made 7 concrete commitments, and let me outline 4 of them for you. The first commitment is UNICEF will invest 10% of its budget to achieve disability inclusion by 2030, spanning development and humanitarian context. 10% of budget to be spent on children with disabilities in development and humanitarian context by 2030. UNICEF will train 75% of its staff on disability inclusion by 2025, in the next 2.5–3 years. UNICEF has committed to strengthen data research and evidence on disability inclusion to inform planning and investment. And lastly, UNICEF will systematically mainstream disability inclusion in its communication and advocacy. And it is through this that UNICEF aims to scale disability inclusion. 41 million persons with disabilities in 2022 are in need of humanitarian assistance. It's a huge number. During disasters, the mortality rate of children are much higher. An inaccessible environment, severely and breakdown of support system, severely restrict children with disabilities, often leading to abandonment. Breakdown of critical services like health, education, child protection puts children with disabilities at heightened risk. For example, if children with disabilities are not able to access emergency education in emergencies, they not only lose on education and learning, but also lose on critical services like nutrition, vaccination, and protection services, which are often delivered through these educational facilities. Unfortunately, planning and assessment in humanitarian and emergency context often do not take into account the needs and rights of children with disabilities. This also leads them to lose out on humanitarian assistance and makes them more prone to experience violence, neglect, and abuse. Now, under the Disability Inclusion Policy and Strategy, UNICEF commits to make its humanitarian planning, monitoring, service delivery more disability inclusive, and it cuts across the development, peace building, and humanitarian spectrum. UNICEF has committed that it will substantively integrate disability inclusion in its risk analysis and introduce substantive and explicit components on disability inclusion in its humanitarian resourcing. And it is through a combination of these factors that I'm going to outline now, which has been a commitment in the DIPAS that we aim to accelerate and scale disability inclusion. Now, one of the 6 cross-sectoral strategic priorities under the DIPAS explicitly commits the organization to accelerate and strengthen disability inclusion in humanitarian action. Capacity building, we know, is key if you want to mainstream disability better and more effectively in humanitarian action. In DIPAS, capacity building and assistance is one of the cross-cutting program strategies. And UNICEF will significantly enhance its work in strengthening the capacity of not only of its own staff, but also partners, so that we are able to better integrate disability inclusion in our humanitarian work. We know data is crucial. UNICEF has been investing time and energy on strengthening disability data in humanitarian action. If you see last couple of years back, the needs assessments, or in fact the humanitarian needs overviews, never disaggregated data by disability. Working with partners, we have been able to make advancements in that area. And UNICEF remains committed to invest more energy, time, and resources in this area. As a cluster lead in education, nutrition, and WASH, we will use our position to make disability inclusion a key component in humanitarian cluster coordination. And not only that, UNICEF will continue to play and actively work with partners to strengthen interagency coordination on disability inclusion. UNICEF will also leverage its dual humanitarian and development role to ensure that the rights and needs of children with disabilities are used, and a rights-based approach is adopted in our work on climate change. This will include expanding our knowledge base and evidence on climate change and disability, so that we can adequately address the impact of climate change related events on children with disabilities. Lastly, and most importantly, the DIPAS will enable UNICEF to further strengthen its engagement of children and youth with disabilities and significantly strengthen our engagement with organizations of persons with disabilities. In conclusion, let me emphasize that if we want to scale up disability inclusion, that is required to reach the significant number of persons, including children with disabilities, that we are not reaching. There are a few elements required. We need to have an ecosystem of progressive policies and procedures. We need to have the capacity to deliver disability inclusion at scale. We need the data and evidence to do that. We need strong coordination and partnerships. And that is what I have outlined over the last several minutes, which DIPAS will enable us to do better. We cannot do it alone. We want and we remain committed to working with partners. I have outlined what the policy says, and later on in this session, you will also get a glimpse into some of the tools, the Disability Inclusion Humanitarian Toolkit that UNICEF has developed along with CBM, which will also help to significantly, we hope, advance disability inclusion. So it's been a great pleasure to be a part of this session, and thank you for your time. Over to you, Elham.
Thank you very much, Gopal. It was very exciting and wonderful to listen to a summary about the disability inclusion policy and strategy. To me, it sounds very comprehensive, gives the whole strategic framework that UNICEF needs, like the 4 commitments that you just mentioned, actually target the 4 corners of transforming disability inclusion, which is capacity building, advocacy, evidence, and of course, funding. So I'm very optimistic about what this strategy can bring about. Of course, to change a strategy to action, we need tools. And that's exactly what UNICEF colleagues have done in collaboration with CBM Global team. They have produced a toolkit giving practitioners and programmers the tools that they need to transform and transfer this policy and strategy to action. So now I invite colleagues Ahmed Ghanem and Charlotte Extel from UNICEF and CBM, who have been doing a lot on preparing this toolkit, to take us within the next 15 minutes through this toolkit, what we can see in this box. Over to you, colleagues.
Thank you. Thank you. So I think I will start. So I'm Charlotte Axelsson, Associate Consultant with CBM Global, and I took part of working on this toolkit together with UNICEF. First, apologies for my voice. I got some little virus in my throat, but I hope I can go through this presentation. If not, I will hand over to my colleague, Tom, who is my backup. So if you can take the next slide, Ahmed. So this toolkit, which was our collaboration started on this back in 2020. It's been a long and really participatory process to get to where we are today. And this has really been designed to accompany the UNICEF guidance, the 6 booklets, including Children with Disabilities in Humanitarian Action, which are comprehensive guides that were developed some years ago, but where there was a need to update, ensure broader socialization of this guidance across UNICEF staff and programs, and also to align them with recent guidance, such as the ISC guidelines and the new commitments, the CCCs. Excuse me, I need to take a sip of water. We can go on to the next slide. So what is this toolkit about then? It's a toolkit that comprises a set of short guidance notes, tip sheets, and some practical tools, and the capacity building package. So this is actually where Ahmed will talk later on. This is addressing some of the parts around capacity building that Gopal mentioned is one of the key strategies for UNICEF on strengthening disability inclusion. This toolkit provides operational guidance as a complement to these booklets on how to include children with disabilities in humanitarian actions. And they are aligned and linked to the core commitments of UNICEF and also other emergency procedures that UNICEF is implementing. We have tried to develop them as practical as possible around planning response, coordinating the response with other actors, the implementation phase, and the monitoring of the response. And it's a live toolkit, which means that it will be updated or complemented and improved based on the use of it among UNICEF staff and partners within a monitoring system and the feedback that is given on the use. And next slide. So yeah, so this was a really nice collaboration between CBM Global and its Inclusion Advisory Group and UNICEF that, as I said, started back in 2020. We did a broad consultation at that time across UNICEF headquarter focal points and regional offices, country offices, around the use of the existing guidance. What was the need, the support needs that were expressed, what the UNICEF cluster leads, how have they used it, what did they know about the guidance, how could they see that it could be improved. So it was quite a broad and long process. 3 regional offices, and I think we had in total around 35 countries represented, and also some of the headquarter other sectors like education, gender, and child protection. And the key findings of this process was a strong feedback on more operational guidance and tips, shorter tools, like easy to use tools, more interactive. Many actually expressed also need of live support, and also to strengthen this guidance to other emergency tools and processes. So after that, we had thinking about the concept and what we thought could work best. So we developed a kind of long list of tools and guidance that came out from the consultation. And there was an internal broad consultation on this list to prioritize the tools that we could develop together and the training package that went along. So we did a first draft of the toolbox and the training package in end of 2021 into 22. And we piloted this training package in the regional offices and also in 1 country offices, the regional offices of East Asia and Pacific and East South Africa region. And we really tried to use this feedback and the recommendation received to improve both the preparedness of the training package and improving the content and the exercises that are in the package. There was also internal consultation of the toolbox. And then last year, after summer, it was all finalized, put in accessible version, edited and designed to be ready for dissemination. And this is where we are today. It's an external launch. I think UNICEF has used it internally already in some of the responses in 2022, because there's been quite a big interest from countries and regions to use these tools. And UNICEF will then put in place monitoring, and Ahmed will talk more about that later on how the tools are used and how they can be adapted and improved later on. And next slide, please. So inside this toolkit, there is a toolbox, as I said, which are 6 tools for now that complement the UNICEF guidance, but covering some additional specific topics that are important to ensure disability inclusion. There are checklists that accompany the sector-specific guidance that I mentioned before, the small booklets, which presents minima actions on some practical examples how to include children with disabilities in these specific sectors. And then the training, 2 training packages. One is looking at key general approaches to inclusion, and the other one is specifically looking at inclusive humanitarian coordination. So next slide, if we go to the toolbox, as I said, there are 6 tools, 2 tip sheets, short ones, and then 4 a bit longer. They're called short guides, a bit longer than the tip sheet, but they are still short. They have been shaped around, we try to identify most common questions that UNICEF disability focal points get from the field and from colleagues and partners in the response on how to include children with disabilities. So we could say there is a kind of an entry one, which is how to get started on disability inclusion in humanitarian action, which can guide the reader into, like, where do I start when I'm either a new focal point, or I see that I need to strengthen this aspect in my response. So it gives tips and further guidance on that. Engaging with organizations of persons with disabilities is the second tip sheet, which is a key aspect also and a commitment of UNICEF. We have one guide on disability inclusion in AAP, accountability to affected population, how to ensure that the accountability mechanism in place ensure children with disabilities are included and reached. There is a short guide on cluster coordination. What are the essential actions that can be done to ensure that there is coordination and that disability is visible in the cluster coordination mechanisms? And one on interagency coordination, which is key for ensuring that disability is really mainstream across agencies, and there is a sharing of resources on how to support this. And the last one, but really important, is when there is the budgeting and mobilizing of resources to ensure that disability is costed, that is included in all these processes of funding and getting resources for the response. These are the 6 tools in the toolbox. And just to give a short example, Ahmad, next slide. So yeah, I just show here on the slide 2 examples of the tools. One of them is the interagency coordination, and the second one is how to get started, this first one that I mentioned. So is just to show a little bit how they are done. There's an introduction, and then they are followed by key topics around the specific tool. And for example, you will see there on the right side on how to get started is really looking at 4 areas where UNICEF has seen the most common questions, like how do I prepare myself? Where do I find the information? How do I keep disability on the agenda? Tips on how you can continue to raise disability in different meetings and coordination structures. Where do I find the entry points for disability inclusion if I don't have so much support? Where can I start? And then also, how can I improve the visibility of children with disabilities in my communication material, when I do budget or monitoring and evaluation? The second part of the toolbox are the checklist. If we change slide again. So as I said, these are checklists that go along each of the guidance booklet. So we have rearranged a little bit. There were already checklists in the guidance, but during the consultation, there was quite a strong interest of pulling out these checklists to have them more easily available and easy to use. So we have rearranged them and aligned them with ISC guidelines, etc., and also introduced certain practical examples. So it's one checklist for each of the sectors. The general one, the education, health, nutrition, child protection, and WASH. And they are also structured around the humanitarian program cycle. So you will find actions from the needs assessment all throughout the programming to the evaluation. And it also highlights actions that are really relevant for coordination and preparedness. As there was also a lot of feedback on the importance of really looking at preparedness, because if things are not in the preparedness phase and across the preparedness cycle, there's also risk that disability inclusions fall between the chairs. So there's also an easy way to find which are the actions that really need to be considered in the preparedness phase for each of these sectors. And then to finalize with the training modules, if you take the next slide. So as I said, there were the 2 training modules that have been developed lately, one which we did together with UNICEF and CBM Global, and I think the other one was developed by UNICEF alone. There is a synchronous training module, which is designed to be delivered face-to-face or remotely with some adaptations. And it's a 2-hour training, primarily for UNICEF staff and country and regional office, but could also be used with partners. And it's really kind of, not the basic introduction, but how to go about and what are the key approaches linked with some practical exercise on how to improve including children with disability in the response. So this has been developed to complement the rollout of the toolbox. And the second training, which is asynchronous, which is an online self-paced module, 50 minutes, which exists already on Agora, UNICEF internal training platform. And this is more focusing around disability inclusive humanitarian coordination. So yes, that was a rapid introduction. I invite you to have a look at this. It's available on the website. I didn't click on it, but you will see, and you will also, if we can share the website in the chat, have a look at it. I think they are really, really interesting tools, and hopefully they would be a practical way of adapting this guidance and also more easy to use and adapted to the needs of partners and UNICEF colleagues at country level. So we are looking forward to, or at least UNICEF are looking forward to hear back from you should you want more further information. And then I will hand over back to you, Ahmed, to talk a little about implementation and the link with this toolbox to the DIPAS rollout.
Thank you, Charlotte. For actually, the toolkit is part of our implementation to the DIPAS. Definitely one of the tools, several tools that we are using in implementation of the DIPAS, and it's have been designed to support effective implementation, not only for the DIPAS but also for UNICEF commitment that we will hear about shortly from our colleague from UNICEF. Actually, the idea here is to ensure that the best programmatic strategy that have been discussed by Gopal expanded the staff partner and the capacity on disability inclusion and humanitarian action. So we are trying using Toolkit and the training to achieve that. Also, the toolkit is part of broader effort to establish capable workforce. The idea here is that we know that to integrate disability inclusion and humanitarian action, one of the main challenges that we are facing is the capacity of the actor themselves, either UNICEF staff or partners, or even a global actor in the field of humanitarian action. So to ensure this inclusion, we are using the toolkit as one of the efforts to fill this gap. Also, we try to ensure the uptake of the new and existing technical resources through an easy to follow, easy to utilize during the humanitarian action tool. The idea that we try to improve the access and uptake within UNICEF, we know exactly that not all the toolkits or guidance, most of the time in the field, it's very difficult to follow big guidance or long one. We have a definitely in the consultation heard a lot about guidance fatigue, how there are a lot of tools that have not been used. So we are trying to design the toolkit to ensure that we are increasing the uptake within UNICEF and within its partner, and hoping in the future within all the humanitarian actors with a coordination with other, of course, organization. The structure and the content itself, we try to make it a dynamic toolkit. That means that we can provide more practical tools and information. The tool will not be static. It will be developed either by updated the current content through consultation and feedback mechanisms that we already started, and we already started to modify some tool to fit the purpose in the ground, and or to add new tools. For example, we are preparing now some specific tool that our colleague in the field have pointed out that needed. For example, preparedness tool, post-disaster need assessment tool, data a specific tool that is asking response to the question about data in coordination with other actors. So some of these tools is designed by UNICEF directly. Some of this tool is designed by coordination and cooperation with other organization and organization of persons with disability. Also, we try to improve the supply side from we know that the knowledge itself have supply and demand side. So from the supply side, we try to ensure that the toolkit and all the other tools that we have are part of the system, not a parallel to the system. So we added disability inclusion as a strong part within humanitarian and competency learning framework within UNICEF. So whenever there are a learning framework or competency framework for actors and capacity building, disability inclusion is a basic part of this, which encourage the adaptation and using the toolkit to fill these competencies need. Also, we build it based on the core commitment that is UNICEF having in generally in humanitarian and development, and we will hear about the core commitment shortly. And we try to integrate it in the different sector topics and tools. So, for example, if we have a toolkit about accountability for affected population, our tool, for example, that is focusing on disability inclusion in accountability for affected population is not only a part of disability inclusion toolkit, but also this specific tool is a part of the accountability for affected population toolkit itself. So we try to have a twin track approach here to ensure that the toolkit is uptaked from different users. Last one, which is demand side, we try to consider considering the UNICEF dual humanitarian and development mandate. As UNICEF is working in both humanitarian and development context, we try to having this cross-border between, or the nexus between humanitarian and development. So we target disability team and partner that is usually working in a specific country in development program to ensure that they have enough capacities in on emergency and humanitarian response. As we all know that with the poly crisis that we have now and the extended difficulty that is facing most of the country, especially after COVID, we know that the border between humanitarian and development have been starting to shrink, and most of the country in all of the time have both situation. Then we are working also with emergency team to ensure that they have enough capacities in disability, and deployment team which are used directly in most of the work in humanitarian action. So by that, we try to ensure that I saw that there are some question and answer in we definitely will back to them in the question part. Thank you, and back to you, Ilham.
Thank you very much, Charlotte and Ahmed. Sounds to be very interesting toolkit, enabling filling the gap between policy and strategy and action in the humanitarian sector. And I myself very much look forward to going through this toolkit and using it in our work. I'm sure our audience are also excited to explore the toolkit more. Yeah, I see also questions are being posted. I encourage colleagues to put your questions in the chat and Q&A section. If you have any person that you want specifically to answer your question, feel free to specify. If you wish to take the floor also, please feel free to raise that in your chat so we can see if we can give you the floor if we have enough time. For now, we are going to continue our session by going to a small panel where we are going to hear about some concrete examples of turning policy to action. First, we stay in UNICEF. We go to Fedia Germa, Chief of Risk Analysis and Preparedness of UNICEF, who will tell us how policy have been transferred into action in emergency preparedness in UNICEF. Thank you very much. I hope I pronounced your name correctly. Over to you.
No problem at all. Very happy to be here. Exciting event, and I'll come in on a few points to complement what colleagues have said. So obviously for us, our strategic plan in UNICEF makes humanitarian action a core part of its work. So it's included throughout, as it is key from a saving lives perspective, building resilience, but also to advance the different goals we have when it comes to sustainable development and realizing children's rights. We have also done a lot around our core commitments for children in emergencies. This is the reference documents when it comes to just the core standards that we wish to have implemented by UNICEF, but also our partners, governments, and everyone else when it comes to humanitarian action for children. And when it comes to moving things from policy to practice, I think a first key piece has been when the CCCs were revised a few years ago to include the work on youth and children's disability as cross-sectoral priority. That means that we have guidance in the core commitments for children, the CCC, that look at how to be more inclusive when it comes to needs assessment, planning and monitoring, but also from the inclusive and safe access to information and services, and the participation of children with disabilities in both program design and decision making. So that is for us a key step to really make sure that we are better at inclusion and participation throughout humanitarian programming. Obviously, colleagues have already talked about the DIPAS and what it offers from the programmatic approaches as well. The collection of views and of data and research and the promotion of rights. So I won't necessarily go more into this, but really looking at the landscape that we have when it comes to humanitarian action. We're sadly at a time where crises are increasing, humanitarian needs are increasing, but the situations are also becoming more complex. We talk about polycrisis in some events. We have climate, conflict, large-scale displacement, public health emergencies, and environments that make it more and more difficult to reach children in need and often the most vulnerable. So in this context, where we are seeing increased risks to children, it is even more important to make sure that we keep children's rights at the center of our collective work. But we do see that despite all our efforts, we still have challenges when it comes to capacity. And I think this is where the practice comes into action. And I'll just speak briefly to some of the key pieces that we're trying to put together when it comes to being more concrete in changing the way that we work. So looking at partners' capacity, this is really where we need to intersect all the work that we do on children with disability inside humanitarian action with efforts around localization and partnership. We need to scale up the work that we do with local organizations of persons with disabilities, and really make sure that this is a meaningful part of the way we work and the way we engage communities. So on the one side, we're investing in UNICEF in expanding our capacity to better embed disability inclusion as a core element of humanitarian action and coordination. And that we're doing that through the rollout of our emergency procedures on the one side, but also to really make sure that it's also reflected in the way we do coordination. We also recognize that we have our own challenges. You know, we have to continue learning as staff, as humanitarian actors. So we're also strengthening capacities around children with disabilities and emergencies across our staffing through building institutional capacity on disability inclusive humanitarian action. And by doing so, we're doing so by really investing in our learning framework and rolling out as well the action toolkit that colleagues were presenting just before. So these are great opportunities. I am myself someone who continues to learn a lot. And I think the fact that we're making this now a core part of our preparedness work as well, and procedures and guidance is also a key step. We're at a time where we are relying more and more on the use of data, which is fantastic. We collect so much data for programming, and it's really key that we make use of it to really inform prioritization, decision-making, and our overall humanitarian action. And as colleagues mentioned, really being able to better collect data on children with disabilities when it comes to access, to services, to humanitarian action is really key. And this is why we continue to push for greater disaggregation of data as part of our monitoring and evaluation systems. Gopal mentioned earlier all the work that's also happening when it comes to the humanitarian needs overview and the humanitarian response plan. And this is something we're working on with our other partners of the UN system and the NGO system and governments to really make sure that those needs are better reflected in those various interagency frameworks that are our key planning processes when it comes to humanitarian action. And that really we focus on the protection risks and barriers that children face, especially when they're on the move with disabilities. So we know that we've done a lot of progress when it comes to working in different countries and regions, creating opportunities, really working with OPDs and including all that work in our localization efforts, increasing our accountability to affected population, and really overall strengthening these partnerships. And we're also trying to leverage the role that we play as UNICEF as a leader, as a programmatic leader, as a coordination leader, as a thought leader as well. And this is why we co-chair the reference group on inclusion of persons with disabilities in humanitarian action. I'm sorry, it's a bit of a mouthful, so the acronym is DRG. To really towards having a better coordination system. I think this is why this is key process of priority is also helping us make progress. So we're hoping that these are efforts and platforms that we can also better leverage. And obviously,
hi.
I don't know. I don't know if it's just me or everybody have problems hearing the presentation.
Hi. The last part was a little bit. The audio was disturbant, and I will. Yeah. I will ask you to also to slow down for the interpreter also.
Yeah,
Thank you.
No, the problem still exists with the quality of your voice.
Sorry, I'm not sure what the issue is.
I don't know.
Is that for me? Hello?
Not for everybody. Yeah, you have internet issues, so audio is not clear.
That's odd.
Yeah, very odd.
I'm not sure if I'm going to cover if you have better internet.
Can you try again?
Maybe if we close the video, it will be improved a little bit.
Yeah, you're right.
Thank you.
Hello?
Yeah.
Is it better?
Yeah, much better.
Oh, interesting. Having worked in hardship, I'm always surprised when internet fails in Geneva or New York.
Yeah, Geneva internet, yeah.
And I'm very sorry, and I well noted on slowing down. I'm not sure when it started being hard to hear.
Maybe the last 30 seconds of what you were just mentioning was not clear.
Okay, perfect. I'm also mindful of time, so no, it was more around you know, the efforts to really be able to scale all the work that is being done. It's really important as well that we really make it a true cross-sectoral priority. So across all the big pieces of humanitarian action that are priorities today. So localization, accountability, affected population, or over community engagement. So these are great opportunities as well to reinforce this work. And I was saying to wrap up that obviously I will conclude on preparedness, as this is also the area of work I oversee. And colleagues were mentioning it earlier on the toolkit. It is essential that we invest in greater preparedness efforts, as this is the only way to make sure that we can really take these efforts to scale when a crisis occurs. And so we're really working with strengthening with our partners and with our colleagues to really invest in greater preparedness through technical support, through additional funding, through preparedness plans, to overall planning as well, to make sure that we are in a greater capacity to respond and to make sure that children are not left behind. So just to conclude, before handing over to my colleague from WFP, by saying that this is a core priority for UNICEF across our humanitarian action, and that we look forward to continuing this efforts with everyone. Thank you.
Thank you very much. Indeed, what UNICEF has already accomplished in advancing disability inclusion in humanitarian action is fantastic, and many great things coming forward. So congratulations to you, and thank you so much for sharing all of that with us. I want to invite our next speaker. I saw Kavita dropped, so I hope she comes back. We have, yeah, you're here?
Yes.
Fantastic. So we have our colleague Kavita Brambit from the World Food Program. She is the senior advisor on disability inclusion. She will tell us about some of the good practices of a World Food Program on including persons with disabilities in humanitarian response that World Food Program is leading. Kavita, we are very much looking forward to hear those great examples from you. Over to you.
Thank you, Elham. Hello, everyone. My name is Kavita Brambat. I'm a brown woman with brown hair wearing a black top, and it's a pleasure to be here with you today. Disability inclusion has become, since 2020, a corporately led initiative within WFP and very much pushed forward by the UN Disability Inclusion Strategy. So for the since 2020 to 2022, we had a disability inclusion roadmap. And one thing I'd really like to highlight is that that was a corporate effort. And when you have a corporate effort, it doesn't necessarily translate into concrete action. And this is really what Gopal was telling us about. And this is really what this conversation here is about today. What we really need to ensure that things happen and there's action is constant visibility, sustained momentum, motivation from everyone, whether you're in the field or whether you're at headquarters, and of course, demonstrable results. And so these are the things that we really have kind of pinpointed as the factors that will really be key to pushing us into making action happen. Yet, as you know, WFP is the largest humanitarian organization. We work in over 120 countries. We have 21,500 staff. I'm going to slow down so Susan can interpret a bit better for me. Scale is an issue. So whilst we are many allies in many places, getting things done doesn't happen automatically. And because this is the case, we have developed really practical actions to make sure that what we think should be done at headquarters is actually happening in the field. So I'll talk you through three things. The first thing that we really want to focus is the entry point, which is on the data side. And I'm not talking about necessarily disaggregation, but the research that we have done with Trinity College Dublin to understand what works and what doesn't work on data collection for disability inclusion within the WFP context. And what we really learned and what has come out of this is that we shouldn't disaggregate at all costs using the methodology, the Washington Group questions. We had a look at what works and what doesn't, and what we saw was that there needs to be purpose, it needs to be feasible, we need to have buy-in, there needs to be quality and a capacity to analyze the data. And when we understood these things, we created a tool for country offices to be able to self-reflect and see really whether this would work for the kind of work that they're doing. The other thing, and this is something that exists across all UN organizations, is that we need to know why we're collecting the data. And this is a discussion that is also happening within HNPW, is are we collecting disaggregated data for the sake of it, or are we actually doing something with that data, and does it translate into better programming? And so we found from speaking to colleagues in many different countries that data is collected, but nothing happens with it. Maybe nothing happens with it because they didn't collect the right data. Bye, Susan. Hello, Amaresh. And sometimes we collect data, but we don't analyze it. So there are many factors in there, but sometimes it really works, like in Sri Lanka, when we worked with the Sri Lankan government and we included the Washington Group questions in a census. So this toolkit is really to make sure that we are thinking critically about how we use data and whether we're collecting the right data. And this has really been a help to all country offices who are embarking on this journey on disability inclusion. Now, the second initiative, which has been a godsend for me personally in a tiny team of 3 people, is that we have a CBM a global international advisory group who set up a disability inclusion help desk that we launched in September 2021. Now, since we launched that help desk, which is a free, easy to use, accessible service for every single WFP staff member, or let's say employee, we've had over 100, just under 150 people registering with 78 different requests. And those requests have gone across all of our 5 regional bureaus, our headquarters, and the majority of them are coming from country offices. Now, what we see in these requests is the majority are for guidance and general advice. It will be anything from, do you have any ideas on how to make our food distributions more accessible? Or how do we ensure country strategic planning is done in a more inclusive way? So these are questions, but we also have capacity building requests that are sent to the help desk. And we also have a request for improving community engagement. So for example, in Indonesia, the CBM help desk helped the country office link with OHANA, which is a local organization for persons with disabilities. And they are now looking at the WFP Indonesia's action plan, country strategic plan, to help them make sure that disability inclusion is better embedded within that. And then I go to so all that to say, it's a model that we started. It was very fresh and new. They're helping us basically fill expertise, resource gaps within a humongous organization. And the more we see the requests being answered, the high levels of satisfaction that we've seen from that help desk means that it's solicited more and more and more, and it's a model that really works for WFP because we are quite new to this work, and the gains for us have been huge. Now I'll go to the third step and the third initiative that we've taken, which is really practical, which is basically the back end, which is so what happens at the end, which is really the monitoring and understanding of whether the data, the advice has been effective in better quality programming. And this is how we've done it. We plugged it into our corporate results framework. So we have 2 process indicators on disability inclusion. One of them is on consultations, so consulting people with disabilities and their representative organizations, which has come with guidance, but let's not mention the word guidance. And then we also have an indicator on accessibility. Now, these indicators are pulled from the UNDIS and the quadrennial comprehensive policy review guidelines. So these are kind of harmonized standards for measuring processes on consultations and processes on accessibility. And we've plugged this into the WFP structure so that all country offices can basically integrate accessibility and consultations as part of their day-to-day work. So these are the 3 practical things I wanted to highlight. Of course, there are challenges, and I mean, the challenges are huge, but the biggest one obviously is scale. Whilst we understand what's happening, it's very hard to make sure this is happening systematically everywhere. The other thing is coordination. So whilst we work on food distribution, I hear our colleagues from UNICEF saying that we work in some countries in disability inclusion working groups, but it's not always the case. I think what we underestimate is that coordination takes time, coordination costs money, and no one really wants to pay us to coordinate. So there's a lot of, we're doing a lot. Luckily, we talk to each other a lot, but actually, what we find sometimes is a duplication of certain guidelines and documents and non-optimization of really good practices. So we need to get better on that. And then there's obviously, I guess, the fact that research is considered a luxury. So we jump in and we create tools and we test tools, but actually sometimes we should know what works and what doesn't because we need to research it. So we've had the luxury of having, I said luxury, so we've had the really great support of Trinity College Dublin to help us on the research, but we really need to think that research is part of solidifying responsible, transparent and valid responses to the work we're doing to remove barriers for people with disabilities. And then the last thing is the culture side, is like making sure that people do not think this is an extra part of their work, but this is part of making sure that we're doing our jobs properly. It's quality programming, it's making sure we're leaving no one behind. And we are at all lengths trying to say that and repeat that, but it needs to carry on in WFP and as group. I'm handing you back to you, Elham. Thank you very much for inviting me to speak to all our colleagues here and to HNPW.
Thank you very much, Kavita. 3 great examples from World Food Program on collaboration with academia, which I think is a very good initiative. Also creating the help desk, which is also fantastic because that also helps like giving concrete, real suggestions and advice to people who are right now facing some challenges. I really hope that these kind of conversations, production of these toolkits and these great examples lead us towards, as you said, systematic implementation of disability inclusion. Now we have a few minutes for questions and answers. So we do have some questions. I want to hand over to Ahmad to tell us a few of the questions that we have received so we can try to answer as many of them as we can. Over to you, Ahmad.
Thank you, Ilham. Please feel free to add a question on the question and the answer, or after that, if we have time, we can also receive some question either on the chat or directly. The first question from Melissa, I'm sorry if I'm not pronouncing the name in the right way. Does UNICEF have any training package available on disability inclusion and humanitarian action? If yes, could you please share the links? We have shared the link in on the chat for this training, for the training that we have, and also shared that the link for Agora platform, which is a UNICEF learning platform. If you search on within this Agora platform, right, disability, you will have all the online available disability training, either in humanitarian or development. And also we are planning to publish the 2-hour training guideline in the coming days, and the training that have been published around the humanitarian coordination is already in Agora. Thank you. The second question, has the toolkit been developed in collaboration with OBD and with persons with disability? If yes, could you please explain how you include those in the toolkit drafting and piloting process?
Yeah, I think a question that you
Oh, yes, I think that both us and maybe also Charlotte and Kavita could answer, because I think that it's either for UNICEF or WFP. Maybe I will start, and Charlotte can and Kavita can complement me. Actually, yes, the toolkit have been long time process. It's nearly we have developed it in 1 year. So there was a huge consultation process at field level. In field, UNICEF already is having some partnership and cooperation with OBD, and we have viewing this as an actor in this consultation process. The consultation process actually have some twin-track approach itself. That means that some tools have been consulted with the actor that is working in humanitarian action. Some consultation have been with disability expert in the field, but also with the organization of persons with disability that is partnership and working with UNICEF in the field. We have this partnership. We have also, as the toolkit is a part of overall package of capacity building that UNICEF is working, there are some other consultation that happen at global level, but in other level through our coordination, like for example, disability reference group working with OBD, as UNICEF is co-chairing that. This was part. Kavita, Charlotte, do you have any added on?
I can speak from a WFP perspective. Mine is less optimistic than yours, Ahmed. So because we had a roadmap which was not a particularly consultative process. It basically built off the UN Disability Inclusion Strategy, which was in itself a consultative process. So I'm glad about that. And to be honest, I'd say we have really tried to include organizations of persons with disabilities through the help desk and through our consultations when we go to country offices. But at a headquarters level, we've definitely included them in doing accessibility audits. But as I said before, it's not systematic enough. Now we hope it's a lot more systematized because of the results framework that we have. But I'd say yes and no is the response from us. Over to you, Charlotte.
Yeah, I don't have so much to add, Ahmed, to what you already said about the toolkit. I know, excuse me, CBM Global is built in our advisory work, that we work with organization of persons with disabilities, and that can be in different ways. I don't know, Tom, if you want to add something on how we try to ensure that. And we also acknowledge that we are not always we could probably do better, but it is one of our fundamental principles to do that, and also to support OPDs to take the lead on advisory, etc. In CBM Global. The process of the toolkit, yeah, I think it's we did have participation of OPDs when we piloted the training, specifically Pacific Disability Forum. But we also, I guess, hope now in the rollout, and since it's a live tool, that we could probably reach further through the partnerships of UNICEF in the field, and to get more feedback also how they're actually being implemented and what might still be missing from their perspective in terms of the way the tools are designed.
Thank you very much. Ahmed, do we have more questions?
Yes, we have a question from Adina Carton. Hello, thank you all for this great presentation. I'm the City of Philadelphia Access and Functional Lead Planning Coordinator in the City Emergency Management. Do you have any advice for implementing targeted programming for people with disability that recognize their intersectional concern regarding systemization? How do we adapt global best practice for local context?
Okay, I don't know if any of the panelists can respond to that.
I mean, I guess I can try and respond to the question on best practices, and it's a really good one. And I think this is why we have this great disability inclusion disability reference group as part of the Interagency Standing Committee team, right? And it's a follow-up from the guidance is to get together and collect these best practices. And it's funny that you bring this up, but best practices are really hard, and even good practices are really hard to get together because they need to be comparable and they need to be guided. And we've done this exercise before. So the Disability Reference Group is really on a path to collect new types of best practices and to really make sure that they circulate amongst the agencies and amongst other NGOs working in this field. So that's how we tackle the part on the best practices. And maybe I can pass it over to Ahmed and Charlotte for the first part of the question. Over.
Maybe I will start for the part, and then I will Charlotte can complement. Also, for the I will focus for the intersectional concern, and it's a very good question because targeting programming themselves it's sometimes very difficult, and I will say that there are no short answer for that. But in our experience, intersectional concern need an intersectoral approach. That means that it's very important that when the organization or the entity working in the ground focusing on or targeting programming person with disability, there should be an intersectoral cooperation between all the teams in different sector and cross-sectoral issue to tackle the issue of intersectionality within the group. For example, if we have usually you have a gender work, GBV, gender-based violence, you have some time accountability for affected population, you have some time working with child protection, and definitely disability maybe program. These teams and sectors, according to the situation, should work together in one program in order to work around the person himself, which is again linked to intersectoral approach and also person-centered approach, which is linked also to consultation with person with disability themselves. We found usually that when you have a consultation, which unfortunately in humanitarian are not perfect, usually you are able to build a more responsive program to the needs, the intersectional concern and the needs. Charlotte or also Gopal, if you wanted to step in, if you're still with us.
Yeah, I think I want just to say that I agree with Kavita on adapting, well, first the challenge of getting good practice and how we collect them. And I think we even don't know so much about how, because we do have a collection of good practices, but I think we know very little on how actually they have been replicated or used at the local context. So I do think we have a gap here. And I think we know it also. That we need to look at as a disability inclusion sector. And yeah, in terms of intersectionality, there is none of the tools that particularly address this issue. We have tried as much as possible to take it into consideration in the tools, although I think it probably is not perfect. But this key of really, when we consult with OPDs, that we reach out further than, let's say, the usual suspects or those with biggest voice. So we need to consult women with disabilities, with different types of disabilities, and we do need to look at other groups, marginalized groups among persons with disabilities, to get the understanding of, excuse me, those particular barriers that they face and see how that can be addressed. So I think there is no, as Ahmed said, easy answer, but there are certainly ways that we can improve to understand the needs and then to design the targeted programming based on their specific needs. Thank you.
Yeah, thank you very much. If I may just add a couple of sentences on that as well, I wanted to mention that for adopting intersectionality, I think this is a joint work. So that's what I always mention whenever this question is being asked, is that we need to do more to be more inclusive in our inclusion work and breaking the silos between different groups who work on gender, disability, age, sexual orientation, race, and other factors. So maybe the best way to develop I'm specifically answering to the colleague who was asking, I think from Philadelphia, that so each context is also slightly different. So maybe the best way is to organize some dialogues between different groups and take some concrete actions or steps from those dialogues about how you can ensure, because each person based on these different identities experience discrimination and exclusion in a different way. And the context of like economic, social, cultural context has a lot of impact on that. So something that works in one context may not necessarily work in the other context, especially in intersectionality issues. So I strongly suggest to you to reach out to colleagues, different colleagues who work on women and children, older persons, youth, racial discrimination, and do a joint effort to find out what are the needs and try to develop like toolkits or concrete action points to address those concerns. So Ahmed, if we have more questions, we can also take one more question maybe before wrapping up.
No, we don't have more question and answer.
All right, then actually we are perfectly on time. I just want to hand over to my colleague Kirsten Lang. I don't know why I pronounce your name. Kirsten Lang, who is the program specialist on disability inclusion in humanitarian action in UNICEF. Kirsten will try to wrap up what we heard within the last 80 minutes about what we heard, what are the future action points, and what comes next. Kirsten, thank you so much.
Great. Are you able to hear me now?
Yes.
Super. Thanks, Elham. Thank you, everybody. And thank you so much to Ahmed and all the organizers of today's event. It's been a really, really interesting discussion. I was just reflecting earlier that particularly since the World Humanitarian Summit in 2016, we've really seen great progress on commitments to disability inclusive humanitarian action. And I was just comparing today's session to the first HNPW that I participated in. We're really seeing this year that there's been a shift in how disability inclusion is being discussed. We heard today that we're now seeing a focus by humanitarian organisations on realising commitments in practice. So going beyond policy and guidance and looking at how we can actually bring about change on the ground. So commonalities in approaches that stood out to me today across the various interventions were work on development of operational tools that help our colleagues in the field to translate policy and guidance into action, together with investment in capacity building, ensuring the availability of context-specific and sector-specific technical advice, thinking critically on the types of data that we need and for what purposes, embedding disability inclusion firmly into monitoring processes and frameworks, And of course, always at the centre is having a high priority on strengthening our partnerships with OPDs. Now, despite all of this progress, we've also heard today, of course, of a number of ongoing challenges and a number of areas of work that we need to continue learning and need to continue working together to address. The conversation we just had on intersectionality is a key. How do we make sure that we're reaching persons with disabilities who are most excluded in humanitarian emergencies? As well as the issue on coordination that we heard coming up a few times. But I'm looking forward to continuing this conversation throughout other events during the remainder of this HNPW, and particularly including in events that are not related specifically to disability inclusion. And this is in line with our understanding that Kavita from WFP also mentioned, that inclusion is core to quality humanitarian response. It shouldn't be seen as something separate. I'm also looking forward to seeing even more progress and learning on how we can all work together, humanitarian actors and OPDs, to ensure that people with disabilities are not left behind in humanitarian response. Thank you, Elham. Back to you.
Thank you very much, Kirsten, for the great recap of what we discussed. And I really hope that, like you just compare 2016 to today, I hope not even in 7 years, but in a couple of years, we see more and more disability inclusion being raised in events and opportunities that are not specifically dedicated to disability inclusion, but mainstream across the sector, across the work of different humanitarian organizations on different topics. I hope to see that day very soon. So I think by this, we are reaching to the end of our event. Thank you so much for staying with us and for all the great questions, to all panelists and speakers who dedicated the time to be with us, and to our interpreters, captioners, to those who organized this behind the scene, in particular to Ahmad, who I know has been spending so much time to organize this. Ahmad, before we close, do you have anything to share or
Thank you, Ilham, for moderating, the great moderation, and thank you for your participation with us.
Thank you very much, and hope to see you soon in other events and opportunities. Have a rest of your day. Wonderful. Bye.
Bye.